Welcome to the Beauty Body Balance Podcast. Hi, I'm Dr. Erin Lucie here at Luminate Clinic, and today we are going to talk about Botox and all the different types of Botox. Who is it good for? Who is it not good for? How it works, and all the things. And I have with me our nurse injector, Maritza.
Hi, guys.
She's been injecting for a little over 4 years, and Botox is one of the most asked for treatments. And I call it kind of like the gateway drug into all the things. It's the makers of Botox themselves do an incredible job marketing. If you have a wrinkle, you need Botox. That's not always the case. And I think in all these previous other episodes, you probably think that I hate Botox by now. But I don't hate it. I love it. It is good for specific things. So let's kind of talk about like how we use it.
I feel like everybody needs Botox, but they don't need Botox for what they think they need Botox. Like I see people like, I need Botox right here. No, you don't.
Yes.
No, you don't. That's not how Botox is going to work.
Yeah.
And they think that it's just the solution to all their problems. And one thing that I hate is that people think that Botox is like a one and done thing. So we have to do so much education on like what Botox actually is.
Yes.
How is it injected? How long is it going to last? Because people are like, oh, so I have to come back every 3 months?
Yes. Yeah, the way that Botox works, Botox is kind of like brand name or short for botulinum toxin type A. It's been around for, I think, almost 30 years now. When I started out in the industry, it was like the first year that Botox was launched. And before it was launched for Botox Cosmetic, it was actually launched in ophthalmology and other things, neurology. Basically, it is a muscle relaxer. So it goes in and stops your eye from twitching. It stops like your body from having contractions. Like it relaxes the muscle and it paralyzes the muscle. And the way that we use it in cosmetics is it paralyzes the muscle so you're not moving or making that line like this aligns here. It was originally made for 11s and then they had it FDA approved for the forehead and then they had it FDA approved for the crow's feet. Because when they started using it around the eyes when your eye was twitching, they saw, like those eyes are smooth and those crow's feet are gone. And then they got the indication for cosmetic. And so basically we do the injections in that area. It softens that muscle contraction. And then it's basically, so it's doing nothing to the skin, right? So let's make that clear. It's doing absolutely nothing to the skin. The needle is going through the skin to the muscle, and then that muscle is relaxed. And then your body, it's giving your body a chance, like a break to grow and heal and repair itself. So at that point, if you were doing microneedling, if you're using peptides, growth factors, your skin is going to heal and recover and get a much better result than just Botox alone. Botox can actually make your skin drier. We can inject it into the skin for acne and it slows oil production. So we have to be careful with the amount of Botox that we use and the locations that we put it. And it does, after 3 months, it's
wears
gone.
off. It's just poof, gone.
Yeah, everybody asks, well, how do I know when my Botox is gone?
You know.
You'll know. Like you'll be sitting at your computer and then all of a sudden it just feels like butterflies just floated right out of your muscle.
And you're like, oh, I'm angry again.
And then you're like, oh man, now I can move again.
Yeah. That's how I always know mine's worn off. Because my daughter's like, why are you mad? I'm not mad.
I'm not mad. Your muscles are
I just squint a lot.
Yeah. So you can use it as what we call like preventative Botox. And preventative is going to be somebody that's like younger. Like I started doing Botox on my sister when she was 21 years old. And because she was getting she's very expressive and she was getting these deep lines. And she was like, I do not want lines like dad has lines. Like you know that they're coming. So we use just like 6 units of Botox, not very much, to just kind of like soften that effect. I did see an article this past weekend on doing, some places are doing Botox on preventative, like younger than 18.
Yeah.
I don't agree with that.
No.
That's a no-go. Because your body is still forming. And whenever we relax a muscle, it can change the shape of your face. So even if you're getting Botox done, you still want to do facials, maybe some gua sha, some like massage on those muscles to keep them tight and keep them going. Otherwise, it will start to like relax down. And there is a tipping point between when you can get Botox and when you can't. Like once you're old enough, let's say like 60, 65, like if we relax that muscle, there's no other muscles helping to kind of keep it in place. And then your eyes will
drops.
then you'll get a drop. And so after 65, you definitely want to focus more in on the lasers and the collagen production and less on the toxin itself. And there's lots of different brands of toxin because Botox was the first one.
So everybody knows Botox.
Everybody knows Botox. And then there is Xeomin. And then
Dysport.
Jeuveau.
Daxxify.
Now there's Lativo. So worldwide, the most popular toxin is Dysport. It's used the most. We also use Dysport in the clinic. Dysport I love for men because it's a little bit stronger and it has a larger spread. So it's great for crow's feet. Like if they have crow's feet that go all the way out, it's great for that area. It's great for this area because this area is really strong. So people that are typically resistant, we use a lot of Dysport. Jeuveau is they use the hashtag new tox.
Yeah.
It's actually the very first toxin that was made for cosmetic purposes. And what's really nice about it is it has a small molecular structure, and so it's really precision. It's like a precision tox. I love that perfect in the lower face.
Yeah. You never mess up.
Yeah, you never mess up with Jeuveau because it's like so precision. And we haven't used Lativo yet. We actually just
got some samples
a couple weeks ago.
So
we'll be trying it out, but that is supposed to have a precision effect also.
Like Jeuveau.
Yeah. So we'll try that out and let you guys know kind of how that works. And then I'd say our practice favorite right now is Daxxify. Daxxify is what we called a peptide-powered toxin. So all the other toxins last 12 weeks, like 3 to 4 months. And then Daxxify is a newer peptide that lasts anywhere from 5 months to 9 months, sometimes 12 months. I see patients back at a year.
Yeah.
So the difference is that peptide is actually going to help the toxin itself, the botulinum toxin type A, last longer without double dosing you. And then it also increases the collagen. So it gives your skin a glow. And that's what we all use here in the office. I've been actually using it so much that I had to think about how to mix a Jeuveau the other day. I couldn't believe it. I had to stop and think how to math because I hadn't used it in so long. I've only been using Daxxify. So much math. All the toxins, they talk about like how many units you're going to use, and all the units are different. So like Dysport is going to be like 3 units to 1. So even though it sounds cheaper, it's not actually cheaper. The same thing with Lativo. It sounds cheaper. It's probably not cheaper. Daxxify, the units are a little bit less, or less than half, more than half.
More than half.
But we actually don't use Daxxify in units. We do it per area because we want to get max glow. So we do the recommended amount of product per area. We do our Daxxify per area because it's more of a treatment to get that collagen production. What's your favorite toxin?
Daxxify. I love glowing.
I know. We should change.
I like a disco ball.
This episode to how good
to
is
how much we love Daxxify. It's so good, and the longevity. Because you don't have to, I'm here every day, so it doesn't matter. But our clients, especially if they have a busy life, I only have to come in twice a year.
Yes.
Some people only once a year, the chosen ones.
Yeah.
What does it feel like to be God's favorite? Ugh.
And the other good thing about that is that every time you get Botox done, right, there is a protein wrapped around it, which is why Botox takes 7 to 10 days. That protein your body has sensitivities to, and it can create an immune system response. It's almost like getting a vaccine done. So every time you have a Botox injection, you're getting that inflammatory immune response. So you want to do your Botox the least amount of time, the least amount of visits per year. Some of our patients will say, oh, just do my eyes this week, and then next week, I'll come in and do here. And then in a couple weeks, I'll do around my mouth. No, you want to do as much as you can in one sitting. And then go into, just save up for your Botox, all in one session, right? Or switch to Daxxify. And actually, if you do Daxxify, if you were to math it, you save $1,500 a year doing Daxxify over regular Botox cosmetic. Because of the frequency. You don't come in as much that you're doing it.
Yeah.
So who's Botox good for? Everybody. People that have, upper movement where we're trying to, slow down those lines and wrinkles.
RBF.
Yeah. 11's here. If you say, and we do hear that a lot, patients say, oh, my daughter said I looked angry and my grandkids said I look angry and I'm not angry. It's just relaxing that line and relaxing around the mouth, the sad face. helping to like stretch the,
The neck.
the platysmal bands.
Make your neck look longer.
It's
your
good for lots
jawline
of
looks
areas.
snatcher.
Snatcher.
If you feel like your eyes are drooping.
Eyes are
To a
drooping.
certain point. If they're too droopy, then we're not doing
Right.
Botox because they'll just droop a bit more.
Yeah. So we're using Botox to help kind of lift those areas and relax the muscles, but it definitely does not do anything for the tone or texture of the skin unless you're using Daxxify.
Yeah.
Yeah.
But even then, you want to do microneedling. You want to be on the correct skincare. You want your retinol. You want everything because it's not a one and done. Nothing's a one and done.
Nothing's one and done.
If it was, then somebody would be really rich just using that one and done thing on people and nobody else would do anything else.
Yeah.
Can we come up with something?
Yeah.
Please.
Nuvaderm, probably.
Yeah.
All right. So if you have any questions about Botox or filler, mostly Botox. If you have any questions about Botox, let us know. Share this with a friend. Come in for a consultation. We'd be happy to answer all of your questions about Botox and where to get started on your cosmetic journey.